Chapter 4 is on the peripheral nervous system, which includes 12 pairs of cranial nerves, 31 pairs of spinal nerves, and various receptors, including receptors for stretch, which are known as proprioception. Those include muscle spindles, Golgi tendon organs, and joint kinesthetic receptors within the joint cavities. We're going to focus on the one in red in my list here, and those would be muscle spindles. A muscle spindle is a stretch receptor which consists of a CTP capsule which contains intrafusal muscle fibers. These are similar to the regular extrafusal fibers with a couple of differences. They are smaller, and in addition to being innervated by a motor neuron, they also receive sensory information. When the entire muscle stretches, not only do the extrafusal fibers stretch, but also the intrafusals. When those stretch, the interfusals, the sensory neurons associated with them will fire information to your brain telling you exactly how stretched each skeletal muscle is. Your brain puts all of this information together to give you a three-dimensional view of where your body is in three-dimensional space. That is known as proprioception. Cranial nerves, CN, are 12 pairs of cranial nerves. They have two names identified by either a name but also by a Roman numeral. Cranial nerves 1, 2, and 8 are purely sensory. That means they only have incoming information towards the CNS. All others, for our purposes, we will refer to as mixed, meaning they have both sensory and motor components. Cranial nerve 10, the vagus, is the only cranial nerve pair that descends into the thoracic and abdominal cavities. Cranial nerve 1, olfactory, sense of smell. The cranial nerve 1 nerve rootlets go through the olfactory foramina of the cribriform plate and then form the olfactory nerves, which carry sensory information of smell to the cerebral cortex. Cranial nerve 2, optic, only purely sensory. It has to do with vision. Here, the photoreceptor cells in the back of the eye within the retina pick up those various visual impulses and form the two optic nerves, one from each eye. Those two then cross at the optic chiasma and ultimately make their way to the visual cortex within the occipital lobes. Cranial nerves 3, 4, and 6 all innervate the extrinsic muscles of the eye. These are skeletal muscles that move the eye around. Not vision, but just moving the eyeball. Let's start backwards with cranial nerve 6, which is the abducens. It innervates the lateral rectus muscle. What happens to the eye when this lateral rectus muscle contracts? It will abduct the eye, therefore the term abducens. Cranial nerve 4 is called the trochlear. Trochlea means pulley, like a little sling through which the tendon of the superior oblique muscle goes through. So cranial nerve 4, that's the number, it's called the trochlear, and it innervates the superior oblique muscle. Cranial nerve 3 is called the oculomotor, and it innervates the remaining 4 extrinsic eye muscles, which include superior rectus, inferior rectus, medial rectus, and the inferior oblique, the shortest muscle coming in at an angle. This slide summarizes all of the cranial nerves that serve the eye. Cranial nerve 2, optic for vision, abducens, trochlear, and oculomotor innervate the extrinsic muscles of the eye for eye movement. Cranial nerve number 5 is called the trigeminal because it has 3 divisions: ophthalmic, maxillary, and mandibular. These are all sensory to the face. If you're going to dentistry, these are the nerves that you're going to try to numb prior to procedures that cause pain. Also, cranial nerve 5 innervates the muscles of mastication, which of course means chewing. This slide shows the major muscles of mastication, which include the temporalis and the masseter muscles. Cranial nerve 7 is the facial nerve. This is the major motor nerve to most of the muscles of facial expression that we have learned. It also provides sensory information for taste to the anterior 2/3 of the tongue. In addition, it has parasympathetic input. Remember, parasympathetic is the rest and digest division. The parasympathetic input is to salivary or saliva-producing glands, including the sublingual and submandibular glands. Also, it has parasympathetic input to the lacrimal or tear gland. Cranial nerve 8 is the vestibulocochlear. It has 2 divisions. The vestibular division is for balance or equilibrium. The cochlear division is for hearing. Think of cochlear implant for hearing. Together, those 2 divisions form cranial nerve 8, a purely sensory nerve. Glossopharyngeal. Glosso means tongue. Pharynx refers to the throat. This nerve pair provides taste to the posterior 1/3 of the tongue. It also provides parasympathetic input to the parotid gland, the largest of the salivary glands, and some of the muscles of swallowing for the pharynx. Cranial nerve 10 is the vagus, which means wandering nerve. It's the only cranial nerve pair that descends down into the abdominal pelvic cavity. Within the throat neck region, it innervates some of the muscles of the throat, including swallowing muscles, larynx, the voice box. In the thoracic and abdominal cavities, it provides parasympathetic input to organs in those particular areas. Cranial nerve 11 is the accessory or spinal accessory because it has some rootlets coming in from the spinal cord. It will be a nerve that innervates the sternocleidomastoid and the trapezius muscles. Remember, sternocleidomastoid rotates the head, the trapezius shrugs the shoulders. Hypoglossal. under the tongue. This cranial nerve pair, 12, goes through the hypoglossal canal. Remember, those canals are on either side of the foramen magnum. Hypoglossal nerves innervate muscles of the tongue. Obviously, those are crucial in speech. Spinal nerves, 31 pairs. The ventral rami either form plexuses or networks, cervical, brachial, lumbar, and sacral. But between the plexuses at levels T2 through T12, they form intercostal, meaning what? Between ribs, spinal nerves. This next slide we have seen before. It indicates the distribution of the 31 pairs of spinal nerves. It also shows the locations of the plexuses and at levels or between levels T2 through T12, the intercostal between ribs spinal nerves. Now we're going to look at each plexus and its major nerves separately. Cervical plexus, C1 through C5, has as its main terminal branches the following: cutaneous sensory, sensory to the skin in that region. The ansa cervicalis, ansa means loop, forms a loop-like structure to innervate infrahyoid muscles, including the now probably familiar sternohyoid, omohyoid, and the thyrohyoid. Phrenic nerve, it's crucial for life. The phrenic nerve innervates the diaphragm muscle, the main muscle of ventilation or breathing. If you want to remember the exact areas that form the phrenic nerve, the roots, the little saying would be C for cervical, C3, 4, and 5 keeps the diaphragm alive. The brachial plexus, very complex, but we will only consider the 5 major terminal branches. Axillary, remember axilla is the armpit, innervates the deltoid muscles and also provides sensory information to the area around the shoulder. Radial innervates the triceps brachii muscle, brachioradialis, and many of the forearm extensors. Musculocutaneous innervates the biceps brachii and the brachialis muscles. Ulnar innervates many or most of the intrinsic muscles of the hand. Median nerve innervates many or most of the flexors. Remember the pars-fail muscles that we have learned or will learn. The median nerve is the one that is affected and pinched in carpal tunnel syndrome. Lumbar plexus has as its main terminal branches the femoral nerve, which innervates the quadriceps femoris group of muscles, and the sartorius. There's also an obturator nerve that innervates the adductors of the thigh, adductor magnus, longus brevis. The saphenous division is sensory branch of the femoral nerve. Finally, the sacral plexus has the superior gluteal nerve, innervating the gluteus medius and the tensor fasciae latae muscles. Inferior gluteal innervates the gluteus maximus. Pudendal nerve innervates the area and muscles around the perineum, also the anal and urethral sphincters. Sciatic nerve, the largest one, is actually two nerves rolled into one epineurium, and those would be the tibial divisions innervating the hamstrings and also many of the toe flexor muscles. The other part of the sciatic is the common fibular, and here we have the fibularis component innervating the fibularis longus and brevis and many of the toe extensors.